more insight into on our presentation today. We're just working on sharing our screen here. Okay, does that look good to you all?
Yes, ma'am.
Great.
All right.
Thank you.
Okay, hello. Thank you for that introduction again, Jerry. That was great. And I'd like to thank everyone for joining us this afternoon. My name is Miranda Cajero, as she mentioned. I'm from the Pueblo of Jemez. It's one of the 19 pueblos in New Mexico and of the 22 tribes here in New Mexico. I am of the Sun Clan, and my Indian name is Yellow Sunflower. We are from the University of Mexico Community Environmental Health Program. Our research is called the Navajo Birth Cohort Study, Early Influences on Child Health Outcomes. The main goal of NBCS ECHO is to assess pregnancy outcomes and child development in relation to uranium waste. Uranium was mined on Navajo Nation for over a period of about 40 years, with 4 mill sites that operated nearly 20 years. During this time, homes were built with mine and mill waste. And despite closures of mines, environmental risk persists. There have been poor efforts to remediate abandoned mines. Exposure to uranium in environment has been linked to a variety of health issues. And leftover mine waste product also includes other metals and metalloids. These exposures occur by way of inhalation and ingestion. The Navajo Birth Cohort is robustly characterized by collecting demographics, cultural characteristics where data is facilitated in a manner that's appropriate and sensitive to cultural considerations. Our cohort does extensive public outreach. We have Navajo staff fluent in their native and traditional ways of living. They participate and recruit in outreach events across the nation. Communication and return of results occurs regularly, and we update our tribal partners at the Navajo Nation IRB conference and to the hospital and clinic leaderships at our sites. This cohort was initiated from community concerns about maternal and child health. In 2010, Congress responded to repeated requests from Navajo communities to develop a 5-year plan to address uranium contamination. This congressional mandate was to study non-occupational exposure to uranium waste among residents of the Navajo Nation and was developed collaboratively by community members, the Navajo government, and federal agencies. NBCS included as a part of that plan. One of the concerns raised by the women were about effects of exposure on pregnancy and birth outcomes. Since this is a community-based approach, we have Navajo staff members living and working in the communities. All 110 chapters across Navajo Nation and across 5 recruitment sites listed here. Our staff are boots on the ground and important to the mission of our work. They are community-based, culturally competent, and relate to our participants very well. This study is funded by NIH and in partnership with Indian Health Service, the Navajo Nation Department of Health, Southwest Research and Information Center, the University of Texas at Austin, as well as the 638 facilities. Research approved from the Navajo Nation Human Research Review Board. Since this is a birth cohort study, it's a longitudinal study, and we enrolled our first participants in 2013 and continue to enroll families today. In the initial birth cohort, we had around 800 families enrolled. In 2016 and in 2024, with new funding, we continued and continue to enroll both new pregnancies and those children in our previous studies. So the pregnancies that we enroll, we collect biospecimens during prenatal and at birth, and follow the baby and from birth through age 17 years with extensive surveys and biospecimen collected at various time points. The issue persists across Indian country with more than 600,000 indigenous peoples living within 10 kilometers or a quarter of a mile of an abandoned uranium mine waste site. The potential for toxicity is largely unknown. however, across Indian country that we now know are linked to susceptibility to environmental contaminants. In this image, the yellow or tan colored is the abandoned uranium mine, also known as the AUM region. On Navajo Nation, there are 524 abandoned mines. All the red dots within that region indicate an abandoned uranium mine, 4 abandoned uranium mills, and more than 1,100 waste sites. In New Mexico, there are 59 AUMs. And there is a jackpile mine in Laguna Pueblo, which is located between Albuquerque and Navajo Nation, which is shown on the bottom right corner there. This jackpile mine is among the largest open pit uranium mine that existed in the world. Also, native populations have a higher reliance on local resources, which could increase exposures. These images are taken from the northeast Church Rock area in New Mexico, and these photos show mills and waste that remained after extracting uranium ore held in large, unlined evaporated ponds, and you can see there are homes close to the tailings, and most of the tailings are not marked. This map here shows a representation of our birth cohort study population, both mining and non-mining chapters across the Navajo Nation. The blue and green dots are current participants, some living near uranium mines and some not living near them. In the birth cohort study, we collect environmental and biological data on exposures and outcomes in multiple ways through surveys, blood and urine collections, medical record reviews to assess exposures and health. On the left here is a list of our Navajo staff community members who are fluent in their native tongue and traditional ways of knowing and living. We are part of a larger ECHO program, Environmental Influences on Child Health Outcomes, an NIH initiative which brings together multiple cohorts across the country. And the size of this cohort will allow comparison of other Indigenous and diverse populations across the U.S., aiming to understand the early environmental exposures and to better evaluate climate change effects on child health development. ECHO is interested in these early exposures and exposure during pregnancy because children and pregnant women are more vulnerable to environmental exposures. Pregnant women have different thermoregulation and are more sensitive and susceptible to extreme heat. For instance, if there is food insecurity because of climate change, that's more of a problem for pregnant mothers and children, since they need more increased nutrient needs during their pregnancy or childhood. We know that prenatal air pollution exposures increases risk for babies during prenatal and overall increased sensitivities to chemical exposure for pregnant women and children. So here, our main finding with birth cohort is that we do see metal exposures in pregnancy and children in our study population. The participants in NBCS have higher average concentrations of urine and uranium compared to the national norms. The graph here is showing exposure for children from birth through age 5, increasing for urine and uranium, and is an ongoing or continuous exposure. So the black dotted line is average for NHANES 50th percentile, and the red dotted line is showing the NHANES 95th percentile. And concentrations exceed national norms by 6 months of age. About 25% of NBCS participants exceed the NHANES 95th percentile. There's also evidence that metals are crossing the placental barrier. Approximately 92% of the babies had detectable uranium at birth were born from mothers who had urine uranium concentrations above the NHANES 50th percentile. I'll now turn it over to Dr. Roman to talk about health effects.
Thanks. One of the adverse outcomes that we see with exposure to metals is an increase in preterm birth. In this figure, we look at concentrations of multiple metals listed on the x-axis such as arsenic, cadmium, and uranium. And darker colors denote greater concentrations, the darker colors and the higher numbers. When we group people into clusters based on their exposures to multiple metals, what we see is 45% of women with the highest exposures to multiple metals in these mixtures have approximately 3-time-fold greater risk of preterm birth. The overall rate of preterm birth in our cohort is about 7%. And prenatal exposure to metals has also been shown in other studies to be associated with increased risk of miscarriage. However, the numbers in our study are not large enough to make that association. In addition, ECHO is now looking at the effects of environmental exposures on fertility. We're trying to get exposures before people become pregnant again and also enrolling their partners. Another key finding we have is that metals exposure is linked to changes in the immune system. Again, we grouped participants into clusters based on their exposures to multiple metals, with darker colors and higher numbers for each box being a higher concentration of these metals or metals metabolites. And what we found is women with higher concentrations of multiple metals have higher levels of proteins linked to inflammation, such as IFN gamma on the right here. Biomarkers of inflammation, like these, are associated with chronic health conditions, such as cardiovascular disease, cancer, diabetes, chronic kidney disease, and autoimmune disorders. It's also known that maternal inflammation has been associated with increased risk of having a child with a neurodevelopmental disorder. Also in our studies, we've shown that in babies, we've observed changes in immune system associated with urine uranium levels alone. One of the aims of our studies is to investigate how different routes of exposure influence toxicity. Main routes of exposure to metals is through ingestion, through food or water, and through inhalation of dust particles. Climate change and extreme weather effects can increase exposures through drought, which would increase concentrations of metals and toxic substances in water, or causing people to rely more on unregulated water sources for either themselves or their livestock. We already see a 5 to 20 times greater than drinking water standard level of uranium in waters in a wetland near the Pueblo of Laguna, near the Jackpile mine. And in addition, inhalation exposures can increase with climate change and extreme weather events such as dust storms and wildfires, as these are shown to carry toxic metals through the air and can disperse many, many miles from the source. These maps show groundwater concentrations of arsenic and uranium on Navajo Nation, with the red color being concentrations greater than the Safe Drinking Water Act thresholds or the maximum contaminant levels, with arsenic on the left and uranium on the right. We've seen that approximately 30% of households lack access to piped-in drinking water, and many are hauling water from unregulated livestock wells. Even those who are on public water systems, many of these public water systems are not yet in compliance with maximum contaminant levels for these toxicants. Researchers at UNM have created an interactive web mapping application showing water quality at unregulated sources across Navajo Nation. This interactive map allows you to choose your region or your well that you use and see what the levels for many of these sampled areas are for multiple metals. This tool allows you to see your specific well, but also to help find clean water sources. Moving to inhalation route of exposure, the main source of exposure is through particulate matter, or what we're breathing in through dust. So inhalation of toxic metal particles can occur through small dust fraction called particulate matter, and these small particulates are made up of complex mixtures. So there's particulate matter 10 and particulate matter 2.5, or PM10 and PM2.5, and the difference is in the size and also in the health effects. PM2.5 can get deeper into the lungs and into the body to cause health effects. And this figure on the right just shows, for size comparisons, the length or the diameter of a human hair, which is 50 to 70 microns across, compared to fine beach sand, which is 90 microns across. PM2.5 is those fractions that are 2.5 microns and less in diameter. and these are airborne and distributed through the air very easily, and also breathed into the lungs very easily. As you get smaller in fraction, these particulates can get deeper into the body. When they're inhaled, coarse particles generally stay in the upper respiratory tract, while very fine and ultrafine particles are getting inhaled deep into the lungs and can then be dispersed throughout the blood system. There are known short-term and long-term effects of PM 2.5, with short-term effects generally the eyes, nose, and throat irritation, skin irritation, or allergies, and acute lower respiratory infections. Whereas long-term effects of being exposed to this chronically can increase your risk of stroke, cardiovascular disease, respiratory infections, and diabetes. There's a limited understanding of how and what specific components of PM cause these effects, but what we know is that heavy metals are bound to particles from both wildfire smoke and dust, increasing the toxicity of PM 2.5. So I mentioned that PM 2.5 can be a complex mixture of chemicals. Researchers at UNM have used imaging to show, this is just one example of a cluster of nanoparticles containing uranium and vanadium, both toxic metals, on respirable clay particle, which can be breathed in. Again, this is a very small particle. The size shows that the size bar on the right lower corner shows that's 100 microns. So this is a very small piece of dust that can be inhaled. And we know that these pieces of dust have varying mineralogy. They're readily lofted by wind. They're mobile in water. And these toxic metals and dust components are significantly redistributed over approximately 80 years since the beginning of mining, where Miranda mentioned about 40 years since the last uranium mine on Navajo Nation closed. But people are still being exposed to these legacy dusts. There are open pit mines in New Mexico. There's erosion happening, and these metals are entering both the environment and then the body. This is a modified image that I took from an article showing the interchangeability between worsening climate change and worsening air pollution, which can lead to health effects. There's a bidirectional relationship between pollution and climate change. We know that climate change impairs dilution and removal processes of pollutants and leaves pollutants in the environment longer. Climate change causes higher temps, decreased rainfall, and air stagnation, which promotes the accumulation of these pollutants. But on the other side, also worsening pollution can damage ecosystems, which then can also contribute to worsening climate change. So there's a bidirectional relationship between these two systems. And on the top here, we have emissions and mining, which can damage ecosystems and then worsen climate change. Unfortunately, these climate change and pollution issues affect some groups more than others. Globally, 9 in 10 people are breathing hazardous air, according to the World Health Organization. In 2021, there was an article showing that a study finds exposure to air pollution is higher for people of color, regardless of their region or their income. So we know that people of color breathe more hazardous air. Racial and ethnic minorities are exposed to higher levels of pollution due to policies and zoning that places pollution sites and major highways in or near communities of color. And these are just some examples of health disparity research that's ongoing, showing racial and ethnic disparities in exposure to metals, to pollutants, and particulate matter. And this isn't just a US problem, this is a global issue. This graph shows that quote unquote clean energy mineral extraction, the majority of it's happening on Indigenous lands. The graph on the bottom shows the relative proportion of energy, minerals, and metals reserves that are actively mined belonging to Indigenous, peasant, both, or neither populations. And 85% of the world's lithium is currently on Indigenous lands. So mining these minerals comes at significant environmental costs, and more costs for some than others. We did want to leave on a positive note. This is a quote from Margaret Mead saying, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." And with that, we just want to acknowledge all of the community environmental health program centers at UNM. In addition to the Navajo Birth Cohort Study, we have other centers that are also addressing questions about the impact of exposure to legacy mine waste on environmental health and human health in different ways. Some of the research and images we've shown you have come from these different projects across UNM. And of course, it's not just UNM. We have lots of collaborators, staff on Navajo Nation, without which we couldn't make this research possible. So thank you to everybody involved. And finally, we have our contact info here. If you'd like to ask us any questions later that you think of, we'll have a question and answer session now. But we also wanted to highlight our artist in residence, Mallory Kutaki. She helps us to visualize our research topics. Here in the middle panels is DNA damage from uranium, and then DNA repair, which we study extensively in cells and in humans, shown by stringing beads back onto a string. And she uses lots of...
There's a slide that's going on top of those other ones.
So that's part of our community engagement for the study as well, showing the artwork that's... I don't know which one to close. All right, well, thank you. That was our presentation for today, and we'll take any questions. Sorry about that. I don't know what the presentation slide was on. Hopefully you guys saw our presentation okay.
Yes, ma'am, it was visible. We are now opening the floor for questions. If anyone have any questions, we don't have anything in the Q&A. Here's the first one. Have you looked into climate impacts on breastfeeding lactation?
We haven't directly looked at that, but that's a great question, which now that we're part of this larger ECHO consortium, which now has over 150,000 mom and baby pairs in it across the US, that's something we're looking at as we just started, or we will just be starting to collect actual breast milk samples. We do have some information on when people are starting and stopping breastfeeding, and it's definitely going to be connected to climate change as we know that people dilute formula with water, so after they're breastfeeding and on formula, that could be a concern as well, and dehydration, water access is going to be an issue in that way as well.
Okay, I had to pull it up. Okay. What role do policymakers and government agencies play in reducing environmental health risks for tribes as well as vulnerable populations like pregnant women and infants?
I think these policymakers play a huge role, as we mentioned, that policies that leave polluted lands, that allow polluters to be in certain areas more than others, is a big zoning issues can be a big factor. Anything else you want to add to policy?
No, I think our research really has a big play in how it affects policy. So,
and here's another question, maybe for Miranda. Are there specific cultural considerations or traditional practices that influence how environmental risks are addressed in tribal communities?
Yes. So can you Can you repeat the question?
Yes, ma'am. Are there, and I'll also type it here. I'm pulling directly from the, there you go. Are there specific cultural considerations or traditional practices that influence how environmental risks are addressed in tribal communities?
Yes, so our staff are traditional in their own way. So we even like collecting teeth or hair or biospecimens. We ask the participants right up front if they would like to receive their specimen back. Um, and and so we're respective of the participants' choice on whether or not they would want to submit a biospecimen.
And I think it's just important with any policies, research, or environmental risk policies that they're working with tribal leadership. A lot of times I feel like people want to impose what they think is best, but really having bidirectional communication is where you get the most progress.
And I guess I have a personal question. Where can I find this is from Drew from NIHB. Where can I find additional materials that talks about like the community initiatives that are working to address these health disparities as it relates to like these mines or climate change?
I would say one resource is one of our collaborators, the Southwest Research and Information Center, or SHRIC, in New Mexico. They have a lot of links to different resources like that. We appreciate the input and should put more on our research website. Mostly our UNM website is more geared towards recruitment and towards our specific research. Are there any other resources? We can also share some after the webinar as well.
You could also.
Yes, ma'am. And then Miss Kara just asked, are you familiar with similar studies happen throughout Indian country? She lives in Minnesota where iron ore and taconite mining is prevalent.
The ECHO program might be one. There might be a facility or a participating university near your area.
Yeah, we also have collaborators that work with the Cheyenne River Sioux tribe and other tribal nations. But yeah, we're really one of the first longitudinal studies that's on sovereign nation on its own. But yeah, there's a wealth of data and research on different toxicants throughout the country in different areas. I am not familiar with the iron and taconite mining specifically, but yeah, unfortunately, there are a lot of health concerns, and with this current administration, they want to continue the mining. So it's even more important than before to voice that these clean energy initiatives are not clean. Uranium is not a renewable resource, and the way that we're getting out of the ground is contaminating the earth and people.
Have you looked at answer live? Have you looked at contaminants in urine? But have you checked? Oh, you looked at contaminants in urine. Have you checked breast milk?
Not yet. We've just been approved by the Navajo IRB to start collecting that from our pregnant women. So we will hopefully get back to you on that. Yeah, one thing we want to avoid is scaring people into not breastfeeding. There's definitely a lot of benefits to it. So we're going to see what we find and report as carefully as we can, how that might be transferring or not.
All right. Do we have any more questions for Dr. Roman and Miss Miranda? What is the EPA's current response to legacy uranium mines? And what is the status of cleaning up those major spills?
So there's really only one of those 524 uranium mines that's considered cleaned up by the EPA. There are ongoing efforts to start cleanup in some mines, but largely there's not a lot done. There's a major spill, one of the largest spill of radioactive material happened on Navajo land at the Church Rock mine, and they're just now starting to move basically 2 waste piles into 1 waste pile, and that's supposedly starting soon. The EPA does have some ongoing research and partners with researchers to try to find some of the best routes or how to go about, but it's not an easy issue.
Right.
So yeah, most are still in an evaluation phase, and they try to get community input during a small window of opportunity where community can respond about certain ideas or proposed plans that the EPA has. But largely, here we are 80 years after the beginning of the mining, and not a lot has been cleaned up.
So in terms of like EPA evaluating and the federal government being aware and only technically clean one, has there been any work or publications that are discussing that effect on health for Native families? Like, even though they're evaluating, they have like some idea of the effects. Are they using those numbers to get more resources to increase cleanup?
Unfortunately, the current administration doesn't seem to be. There's been very slow turnaround before that, regardless.
Okay.
But yeah, there are, we were able to use our research to get one of the sites near Blue Gap Techi on Navajo Nation on a priority list. It's not necessarily a Superfund site, but it's on a priority list for cleanup. There are plans to clean up some of these orphan mines. Unfortunately, the government has sort of cited that after a certain year, I believe it was, I want to say in the 70s, that it wasn't the U.S. government that was mining for uranium for war efforts. It was independent companies using uranium for energy. So they're trying to get off the hook in that way, in some respects. So they're really it's a slow ongoing effort, and we're hoping that our research shows that it's a little bit more imperative to do this now. Most of these tribes and communities have been waiting long enough.
I agree. Another question from Q&A. Does the contamination also link to stillbirth?
We don't have that research from our study. In some ways, that's a good thing. We don't have the numbers of stillbirth or miscarriages in our study to make any associations, but there is some past research from others that is cited that causes these adverse birth effects that we know that pollution and metals are involved.
Okay, and just feeding off of that question, what can people do to protect themselves from breathing in those microscopic particles in the air if they're by active site?
Yeah. Air filtration systems are, beneficial. That being said, that's not accessible for everybody. On these high wind or extreme weather days, it's advised to stay inside. We're all too familiar because of COVID with masks. Masks do work. Again, to tell a community to start wearing masks is maybe not the most feasible either. So yeah, I would say really the most feasible would be to just try to stay indoors on windy days. That's also a policy issue. Hopefully, policymakers can help people who may have to work outside make regulations for times when particulate matter in the air is high. There are resources online where you can go to see your air quality at the time. So in times when there's poor air quality, staying inside and maybe using some of these protective measures is the best we can do for now.
Another question from Q&A. It's a statement with a question. March of Dimes downgrades New Mexico healthy baby ratings for low birth weight, which high altitude contributes to already. But adding the contamination to preterm birth or low birth weight, can we push EPA to address this through March of Dimes?
It's an interesting question. I think that would be great if that initiative could be pushed through, because we do know that these associations occur, that preterm birth and low birth weight are associated with some of these toxicants, and to make that a priority would be great. I don't have any direct experience with that, but.
And I am also putting a link to the air quality map. So if people want to put in their address or their zip code, it can tell you about your air quality. So we have no more questions in the Q&A. Do we have any more questions for the audience? All righty. And so we just want to take this time. I don't know if we can use emojis, but my traditional way of closing out is to show my gratitude and my thank you by asking everyone to use their emojis to send you roses and claps and praises. And so imaginary, pretend like you just see the hearts, the blowing up in the hands, and all of that is on the screen. We want to thank you, Miss Miranda and Dr. Roman, they can use it in the chat. Okay, they can do it through the chat.
Thank you, appreciate that. It's been an honor.
Thank you for joining us today, sharing this wealth of knowledge, as well as the resources. And if you have any additional resources, please note that once Miss Dr. Roman send those to me, I will add them to her last slide, as well as these two resources that she shared about the Southwest Research and Information Center and the air quality as well. So again, we want to thank you for joining us. We want you to go drink some water. We want you to go hug on yourself. We want you to go hug on somebody else. Ask for permission. Ask for permission before you touch people. And we want you to go have an awesome day. Go be as awesome as you already are. You are loved, and be a blessing. Take care. Thank you. Bye-bye.
Thank you.